Hello, welcome to my restorative physical therapy. I'm Dr. Jenny Pruitt, and today we are going to be talking about pelvic floor dysfunction. A little bit of a disclaimer first. I am not a pelvic floor physical therapist. There is such a thing, and if you have pelvic floor dysfunction, I highly recommend that you find one. If you look up APTA and pelvic health, they have a whole page with resources now where you can search for a provider in your area and they'll help you find one. And in general, I've never had anybody have a bad thing to say about a single pelvic floor physical therapist. They are awesome. They're really, really good at what they do, and what they do is so, so important. So if you think you have significant pelvic floor dysfunction, please find your person, find your teammate. Very, very beneficial for you. If you want to use this as a resource to help you get started, pelvic floor dysfunction refers to really any dysfunction of urination, defecation, or intercourse. So peeing, pooping, or having sex. Typically, when we talk about pelvic floor dysfunction, we are almost always talking about women who have had children who have leakage afterwards, or problems with the bottom of their pelvis, their pelvic floor. So that is what pelvic floor dysfunction is. So if that's you and you want to get started with the tip sheet, you can head over there. But if you do know that your issue is pretty significant, highly recommend checking out the APTA page for pelvic health or pelvic floor dysfunction and finding a provider in your area.